Hello everyone, my name is Natseli Godfrey. I'm a fourth year student at Makerere University and we are going to go through HIV screening and testing today. HIV testing is a simple step towards a healthy future. For today's video, we are going to cover the following contents. We are going to cover HIV testing eligibility and screening in children between 18 months and 14 years of age, in adolescents and adults above 15 years of age. We shall cover HIV testing kits, the HIV testing algorithm, and after that we shall see how to deal with inconclusive HIV results. So let us begin with eligibility. Who is eligible for HIV testing? During eligibility screening, who would be the best person to talk to? If the person is below 12 years of age, we talk to their caregiver or the parent. Whereas if the person is 12 years of age and above, we can directly talk to that person. So during eligibility screening, we have to create a safe environment and conducive for this to happen. So usually we start by creating rapport with maybe the child or the adolescent or the caregiver of this child. After creating rapport, we assure them of confidentiality. Remember, confidentiality is one of the main principles of HIV testing. After assuring confidentiality as a healthcare worker, we should watch both the verbal and non-verbal language of these patients. Are they comfortable? How are they communicating? Are they nervous? Are they scared? Are they being open with you? We must make sure that we provide a conducive environment during this process. And after this, we clarify any questions, concerns, or issues the patient may be having. And remember, always be empathetic. During the algorithm for testing for a child's HIV status, number one, the first question we ask is, has the child ever been tested for HIV? If no, then you go ahead and screen the child using the eligibility screening tool that we shall talk about shortly. And if the child has ever been tested, then we want to find out, was that test a confirmed positive? If it was a negative result, we do not test for HIV again unless there is a new exposure. If it was a positive result, yes, then we ask ourselves, the child currently on antiretroviral therapy ART. If the child is not on antiretroviral therapy, we immediately link that child to services of antiretroviral therapy. Whereas if the child is already on ART, we offer adherence counseling and confirm using the ART card. Let's now go to the eligibility screening tool, okay? Now, let's say you're dealing with a child below 12 years of age or even an adolescent. You'd want to know, number one, about their parent. Was this mother diagnosed with HIV? If the answer is yes, you mark that. That's a point. And if the answer is no, you also mark that. If the person giving you the information is not sure, we'll take that as a yes. And then second question, has the child had any recurrent illnesses in the last 3 months? This goes for all kinds of illnesses in the last 3 months, and you have to find out if there are any medications for these illnesses and how long they lasted and what symptoms they presented with. If the answer is yes, that's a point to note. The next question you want to ask is, has the child been having any recurrent skin conditions? Now, you ask this in two parts. Number one, has the child had skin conditions? Yes. Have they been recurrent? Is also very important as the second part of the question. Because you don't know if it has been one or two that were managed and they healed, then that's a no. But if there have been more than that, you take it as a yes. Number three, has the child been diagnosed with or treated for TB before? If they know and they've had a diagnosis and been treated, that's a yes. If they are not sure, you'll take that as a no, because TB has to be diagnosed. Another question to ask is, has there been any weight loss in the last 3 months or in the months prior? It's important. Now, also, weight loss may be a bit difficult to assess, especially if the caregiver has not been the one staying with the child. So we can tell weight loss through maybe a loss in muscle bulk, or the clothes start fitting loosely, or just a general emaciated child, I should say. If the caregiver is not sure about the weight loss, you take the answer as no. The final question to ask is the child growing well? So whereas growth may be hard to assess, the child's growth can be compared to children of the same age, maybe compared to weight and height charts that are present, or according to the mother's or caregiver's subjective opinion. So we've asked a number of questions. So if the answer to any of those questions is a yes, and for the last question is a no, because we asked about a child growing well. So if the answer to 2 or more is a yes, then you go ahead and test that child for HIV using the algorithm we just talked about a few minutes back. So for adolescents 15 years and above, the eligibility screening is as follows. So number one, you'd want to know. The questions to this answers to this are yes or no. So you'd want to know, has this person tested for HIV in the last 12 months? Yes or no. Then, has the person been diagnosed with or treated for TB before? Because TB is an important infection during HIV. Then you'd want to know if they have been having signs and symptoms of a sexually transmitted infection. And then after that, you'll want to know if they have had a recent diagnosis of hepatitis B or C. Another question to ask if they have experienced any gender-based violence recently or in their lifetime. Another question to ask is if these people have had a self-test of HIV and was positive in the self-diagnostic tests that people do. And if they have been exposed to blood and body fluids of someone who is HIV positive, especially for health workers who are most often exposed to these. We also want to ask if they have had any signs and symptoms of HIV infection in the past few months. Now, for someone who has not done an HIV test in the past 3 months, there are 3 major questions to ask. Number one, have they had any sexual intercourse with someone of unknown HIV status? Question number 2, have they had sexual intercourse with someone who is a known HIV positive? And lastly, if they've begun sharing needles or other sharp objects with other people. So if the answer to any of these questions is a yes, then that person qualifies to be tested for HIV. And if the answer to all the above questions is no, then that person does not qualify, is not eligible. The HIV testing kits that we use. I'll start with the HIV 1 or 2 STAT-PAK assay. Now the STAT-PAK detects antibodies to HIV 1 and 2. And we can use fingerstick whole blood, venous whole blood, and serum or plasma specimens. The BioLine also tests for HIV 1 or 2, and it's an HIV antibody test. It's an immunochromatographic assay, and it's differential and qualitative in detection of all isotypes of HIV, and tests for all antibodies specific to HIV 1, including subtype 0 and HIV 2 at the same time. Also, we use a human serum, plasma, or whole blood. The determine HIV 1 and 2 antigen-antibody combo is a qualitative immunoassay and detects HIV 1 type 1p24 antigen and antibodies to HIV type 1 and 2. Now that's important because this can be used to distinguish between acute infection, where you will have the antigens without the antibodies, and from established infection, where the specimen will be positive for the antibodies. Please note that. Also, it's usually the first test done at point of care, and we use the same specimen, that is human serum, plasma, and whole blood, both a finger stick and venipuncture. Finally, I want us to talk about the testing algorithm for HIV. So we start with a determine. When you do a determine test, it may be reactive or non-reactive. If it's non-reactive, you're HIV negative, and that is confirmed, okay? It is always 100% for negative tests. Whereas, if it is reactive, then we have to do a confirmatory test using the STAT-PAK. Now, when you do the STAT-PAK test, it may be reactive or non-reactive. If it is reactive, then that is a confirmed HIV positive result, okay? If it is non-reactive, then that means there is some disparity between the two tests, and we need a tiebreaker. That's when we bring in the SD BioLine. Now, SD BioLine is supposed to be the tiebreaker because you've had a determine giving you a positive, a STAT-PAK giving you a negative, and SD BioLine must tell us what is the real result. When you do the SD BioLine and you get a non-reactive result, we report that person as HIV negative. Whereas if it is reactive, we report that as inconclusive. Why inconclusive? Because determine gave us reactive, STAT-PAK gave us non-reactive, and Bellon has given us what? Reactive. So that means that is inconclusive. If the results are inconclusive, we test again after 14 days. How would we deal with inconclusive results after the 14 days? So if we still get an inconclusive result after 14 days, we send a sample to the national laboratories of a UVRI or whatever the national laboratories may be in your setting, and we label that sample, in this case as second inconclusive, and then the results that come back will tell us whether it's a positive or a negative result. Thank you very much for watching. Please follow and subscribe to Med Scenarios.